Hello, Namaste, Assalamu alaikum. My name is Dr. Rajayashree. I'm a general surgeon. I'm not an oncologist, I'm not a cancer surgeon, but I'm a general surgeon. But over a period of time, for the last 20 years, I've been dedicating my life to breast cancer awareness in the form of giving lectures, educating people around how to take care of their breasts, when to go for a checkup, how to detect early, etc. And in the clinic that I have, which is Muscat Clinic in Al Kuwait, it is exclusively started for ladies for breast examination and diagnosis, that is to detect breast cancer early. But over a period of time, we also know that men can get breast cancer, so I have female and male patients in my clinic. And since hemorrhoids and piles, fissures are also a very personal part of a woman, being a general surgeon, I also treat the perianal diseases. But my main aim, my vision and my mission is to see Oman with very less incidence of breast cancer, or if not zero, at least the least incidence of breast cancer. And so I go usually to different parts of Oman with the help of Oman Cancer Association, where I am a board member for the last 10 years, and this time I'm continue to be a member, and I do a lot of volunteering, give a lot of breast check all over Oman and even outside the country, and give a lot of lectures for awareness. And I'm there 24/7 for anybody who needs me to ask about any breast cancer issues. Cancer is a disease which is prevalent in the present era a lot. You must be hearing it. It is the name of a disease that is prevalent from head to foot of any tissue or any organ in the body. Now, normally what happens is the different cells or tissues in our body, they multiply. But they multiply in a particular rate, and they produce the same parent tissue. Now, that is what normally happens. Whereas when it multiplies in a higher rate, then the number of cells become more and they form a tumor, which is called a benign tumor, which is not a cancer, it is not malignant. Whereas sometimes what happens is the multiplication becomes too much and at a very high rate, a geometrical rate, and in an erratic way. The cells that are produced are not the same as the mother tissue. Instead, it will be of various shapes, sizes and everything, and this is called a malignant or a cancer. Now, this can happen in any part of the body from head to foot. Why do we call it cancer? You know, Cancer, the zodiac sign, there's a crab, right? The crab actually holds on, it never leaves you. Once it pushes its claws into that thing that it catches, it never leaves. So that is what is cancer, and this is equal to that zodiac sign. That's it. Anyone can get cancer. Cancer does not have any boundaries. There is no race, religion or caste or color. And in fact, any age from newborn babies onwards until old age, 90, 100, anybody can get cancer. There is no one particular reason or cause for cancer. In fact, it is many risk factors put together, or there may be many reasons actually. So cancer is not 100% genetic. In fact, it's about only 10 to 15% that it is genetic, or in the genes you can get it from your family, which means if a father or mother has got cancer, doesn't mean that the child will get cancer. The same way for the siblings. But it's a risk factor. So the same way, there are many risk factors. And some of the risk factors are age, the gender. For example, prostate cancer, men can get it. And breast cancer, female, and even men can get it. So there are risk factors, and you have to be aware of the risk factors. Now, in risk factors, there are two different things which I always say is, one is natural risk factors, like you cannot change them, the gender, the increasing age, etc. Whereas the changeable ones, that is what is 85%. That is, you can be responsible for preventing cancer. So the thing is, and what are those risk factors? I'm sure you all know. It's like smoking. One can avoid smoking, isn't it? So that we don't get lung cancer. The same way, too much of alcohol. And there are so many about diet. These days, people take all kinds of junk foods and all that. And people, some of them, they live a sedentary lifestyle without any exercise. So diet, obesity, and exercise, all these three are interrelated. Then stress, sleeplessness, and many other factors. So these are risk factors and you can avoid them. And also it is said that you can prevent almost 85 to 90% of the cancer if you put your mind to it. There is no vaccine for cancer. As I told you, the cancers, they don't have a particular reason or cause. Now, whenever we have found a cause because of a bacteria or a virus, for example, because of the human papilloma virus, then there is a vaccine. So for cervical cancer, we can prevent it to a lot extent by this cervical vaccine. But all cervical cancers are not because of virus. So only those cancers that are caused by that particular virus you can have a vaccine for. So in general, we do not have vaccines for all cancers. Many cancers can be cured if there is an early detection. But whenever you present an advanced stage, then the chance of cure is very low. Early detection is the key to curing cancer. So most of the cancers, especially like breast cancer, prostate cancer, etc., when you detect early, then the chances are 99% cure. Why is it happening, the cancer? That is the same as the causes, isn't it? Especially in the present era, there are hundreds of reasons why. Pollution, their lifestyles, all our lifestyles have completely changed, and there are also other factors like smoking. Now even ladies have started smoking, and even children, high school children have started smoking. And then food habits, we have more fast food, and people like to eat out more, and it's all because of the processed foods. There are so many reasons. And stress, now everybody has got more stress. And the other thing is sleeplessness. Sleeplessness means there is lack of sleep. You need at least 6 to 7 hours in an adult, and even that is not available. So all these are reasons they make you susceptible to cancer. Now, is it a serious disease? Yes. As I said initially, if you find it, then it is curable or it can be treated. But most of the time, cancers appear without any sign or symptom. So by the time the people find out that they have cancer, it becomes actually fatal, or the treatment modalities are less. Then it becomes a serious disease. So cancer, in general life, it's a serious thing, and people are scared of it, and they feel that it is death. But it is not so if you detect early. Females can get any cancers, but females per se cancers means it is the female genital organs, which includes uterus, cervix, ovaries, the fallopian tubes, the vagina, as well as the breast. Breast, even men have, and so mostly women get breast cancer, but men can also get breast cancer, about 1%. And uterine cancer is of the main uterus and the wall. And the ovaries means there are two ovaries, right and left. You could have cancer of the ovary. The fallopian tubes, which is the tube connecting from the uterus to the ovary, and the cervix, which is the last part of the uterus or the mouth of the uterus, and the vagina. These are the female cancers. The commonest cancer for female is breast cancer. In fact, among all cancers, male cancers, female cancers, everything, number one cancer is breast cancer. And the other second commonest cancer in women is cervical cancer. Common signs and symptoms. For the main organs like the uterus, ovary, the fallopian tube, cervix, etc., it can be a lower abdominal discomfort or a pain which is persisting for some time, or it can be an irregular bleeding which is not the normal routine. It can be even a swelling that you can feel sometimes. So these are the commonest signs and symptoms. I believe that you do not wait for signs and symptoms. You go for a regular checkup. For example, for cervical cancer, it has been said that from 35 years of age, every woman should go for a cervical screening test, which is called pap smear. So you can detect even precancerous lesions. And same, breast cancer is the commonest. And breast cancer also, you can actually screen yourself by monthly self-breast examination at your home, which can start from a young ages as young as 15, 16 years after your period starts. And from 35 years, go and see a doctor and do a clinical breast examination. And after 40 years, a mammogram. But you need to continue the self-breast examination as long as you live. Now, as I said before, it is finding a lump in the breast or any changes in the breast is actually, we don't wait for such lumps to be found. Anything that starts like a salt grain to become 1 centimeter in the breast, it takes almost 3 years in general. So we don't wait for it. We would like to catch it early when it is in the salt grain form, where it needs only a surgery and mostly no chemo or radio at all. So it is better to detect early, and the earlier you detect, it is better. At that time, there are no signs or symptoms. So do not wait for signs and symptoms. Go for regular checkup. Ladies should go to the hospital in general from 35 years of age every year and get screened for cervical cancer via pap smear. And for the breast, they should go for a clinical breast examination either to your own gynecologist or your family physician. This is every year. This is an international recommendation. Apart from that, from 15 years of age, you should do the self-breast examination at home every month. Now, other than that, whenever you have a persistent pain in the abdomen, lower abdomen, or a lower backache associated with an abdominal pain, or you have irregular bleeding, that is, which is not a regular, it has been going on regular for some time and suddenly you have irregular periods, you need to, or your periods have stopped in menopause and suddenly you have bleeding, then you will have to go and get checked. Another important thing is, especially for cervical cancer, if during intercourse you have bleeding every time, that is an important sign that you have to go and talk to the doctor about. And if you have recurrent infections of the vagina and the cervical area, whitish discharge associated with burning, you have to go and get yourself checked for cervical cancer. Tests for female cancers can be from clinical examination, that is being examined by the doctor, to X-ray techniques or imaging techniques and blood tests. Now let's start with the breast. In breast, of course, it is the simplest is the ultrasound scanning of the breast, in which the doctor can find out even as small as 3 to 4 millimeters. Ultrasound can be done at any time, at any age, even if the lady is pregnant. It is not harmful. It is the simplest technique. It can be done before periods or after periods, whether you're under menopause or post-menopausal, ultrasound is the safest. And in a good ultrasonologist or radiologist's hand, we can pick up lesions as small as 3 to 4 millimeter. Now, mammogram is a test which is an X-ray, which is still the gold standard for breast cancer, should be done only after 40 years of age in general. It is better to do it after periods. It must be done after periods because it is an X-ray. So if a person is pregnant, even at 40 years, people are still fertile, the ladies are. So it should be done after periods because it's an X-ray. So if there is no chance of you being pregnant. So 5 days after periods, you do a mammogram. Mammogram is a test which is 4 X-rays, which is done on the breast, from pressing from top to bottom and to the side, corner-wise, to the right and the left. So there are 4 pictures taken. Sometimes you cannot do a mammogram, especially in a younger age group, and you need to evaluate more. Or if you're not able to see by the mammogram, then we do an MRI of the breast. Now, of all these, mammogram has got a bit of radiation, but not too much as everybody gets scared. The third thing is, once if we find that there is a lump which is not so good, we need to evaluate it more, then we do what is known as a biopsy, which can be either just by putting a small needle, taking some cells called fine needle aspiration cytology, or we remove a small piece by a true cut biopsy. So these are the tests for breast. Now, for the uterus, the ovaries and fallopian tubes, we do an ultrasound of the abdomen, which is the simplest and the best, and there are also tumor markers like CA125, and for the breast it is CA15.3. It's a blood test for a tumor marker. It's not 100% specific, but it is also something that guides you. And in case of cervical cancer, I was telling about the pap smear, which is a smear that is taken by the gynecologist from the tip or the end of the uterus, which is the cervix, and it is sent to the lab. One can identify precancerous tissue change in the cervix. So this should be again done after 35 years of age, or if the doctor feels because of recurrent infections or certain symptoms like bleeding after intercourse, then they will do the pap smear test. So these are the blood tests and the imaging techniques that can be done. Cancer diagnosis means we go for a checkup, and in the checkup, if there is something found, then we go to a cancer center. But diagnosing is usually not done in a cancer center. It is done by your physician. So whenever you have symptoms, or if you're going for the screening, a regular screening from 35 years of age, if they found an abnormal lesion, then they will go for a biopsy. This is the definite diagnostic test. Without a histopathological answer or an evidence of cancer, the treatment cannot be started. Now, once you are diagnosed to have cancer, then the treatment is an oncology center by the oncologist, the radiotherapist, etc. So that is in an oncology center. All cancers are treatable, especially if it is detected in the early stage, it is curable. So only in the late stage, the treatment options are very less, and so the chance of curing it also is very, very low. Other than that, all cancers are treatable and even curable in the early stage. We can prevent any cancer, and so female cancer, about 80 to 85% by living a healthy lifestyle, having healthy food, doing regular exercise and not being obese, having adequate sleep and stress-free with a lot of activities. Also, other factors like not smoking, not having too much of drinks, alcoholic drinks, and coffee also is not very good, especially big cups of coffee. And hormonal medications, if you're taking for a long time, it can also give rise to some of the female cancers. And in the diet, try to have less of white products like sugar, white flour, etc., and try to avoid paratha, etc. All these can also give rise to cancers. So these are the ones that we can prevent by a healthy lifestyle. Now, in case of cervical cancer, we have one particular type which is called the cancer produced by the virus, the human papilloma virus, which is transmitted from partner. So cervical cancer, you have to remember that having multiple partners is one of the reasons, and in fact early sexual activity is also another, which means that you could come across any cervical human papilloma virus. So these are the main things to avoid cervical cancer: have safe sex and also not have recurrent cervical infections. This is how we can prevent cervical cancer. Cancer is because of the multiplication of cells, isn't it? So when we give a chemotherapy or a drug to destroy these cancer cells, these medicines or drugs go in the blood and attack the growing cells. So all those growing cells in our body, for example, the hair, it's got a growing germinating cells, and the nail, and even the blood cells. Every time new blood is being produced in the bone marrow. So once a person has got a chemotherapy, then when this medicine acts in the body, which is in the first few days, the growing cells die. So the hair fall is there. In fact, once you stop the chemotherapy, the hair fall stops and new hair grows without any hair fall. Stage of a cancer means after it started, which level is it or stage it is, that is it initial or has it been there for a long time? Most of the cancers, we don't know when it starts, but by the way, when we do the test, we find them, then we can decipher or decide which stage it is in. So usually the first 0 stage to 1 stages, it is within that particular tissue itself. It is not spread anywhere, it's not broken the boundaries and gone out of that particular tissue. The second and the third stage, it would have gone to the nearby tissue and it would go to the nearby lymph nodes. The 4 stages, it goes beyond the lymph nodes even and goes to other organs. And that is how it is initial stage, and by the time it is third stage, it has actually crossed that particular tissue and gone to the nearby nodes and within that tissue itself, within that organ itself. Once it goes to a distant organ, then it becomes the 4th or the 5th stage. Risk factors for these cancers: 1, it can be divided into the unchangeable and the changeable ones. The unchangeable or natural risk factors are being a woman, increasing age, and previous history of any cancer. Family history to about 10 to 15% is important, and childbearing. It has been found that by research that when you have children, your first child by 30 years of age, and if you're breastfeeding your child after at least for 1 year, then the chance of getting breast cancer is very low. And the same goes for ovarian cancer. A lady who breastfeeds her child, the chances of ovarian cancer is low. See, these are not 100% because it involves many risk factors. So these are natural risk factors. And in breast, one more thing is about menarche, or the first time you get your periods, and the menopause. Breast cancer, one of the main causative thing is the estrogen hormone. So when your body is exposed to estrogen for a longer time, the chances of getting breast cancer is higher. So if a girl attains puberty or gets her first periods at an early age, like 9 years, 8 years, then the body gets exposed to estrogen for a longer time. The same goes when a lady gets a menopause later than 53, 54, like that, then again the chance of getting breast cancer is higher. So these are all natural risk factors which are not in our hands. Whereas the rest of it is responsible for about 85% of the cancer. In the natural, we also have the genes, family history, but it's only about 10 to 15%. In this, those that can be prevented comes smoking, excess alcohol intake, too much of coffee intake, taking a lot long-term hormonal medications, and having a lot of red meat or the processed food. All these things are other factors. These are having risk factors. And smoking, and people who are working in newspaper places where there is paints and dyes, etc., being used in overpolluted areas, the chances of getting lung cancer is more. But female cancers per se, it is the lifestyle that you have to take care by food, obesity, and exercise. Treatment options for any cancer will be in the form of surgery, chemotherapy, radiotherapy, immunotherapy, and hormone therapy. It depends upon each patient, what kind of a cancer the person has, what is the stage. So that cannot be generalized and said, but these are the options. Lifestyle in the present era, there are a lot of things. If you start counting it from food habits, this is the basic major thing. Everybody's into processed foods, fast foods, fizzy drinks, and I don't know whether I can stop these things, because people still continue to have that. So food habits, it starts from home. So if the mother who is responsible for the kitchen will have a habit of vegetable salad, fruit salad, and healthy foods, then the children also learn that, and when they grow up, they learn to continue this. So that is the basic thing. Second thing is about activity. You have to exercise, or not necessarily go to the gym, not necessarily do yoga or anything. Any type of exercise, about 10 minutes without interruption if you do, then the unwanted fat melts away. So same way, the cancer producing things also melt away. So chances of getting cancer is lesser. And fat or obesity. Fat cells are responsible for again producing cancer by increasing those cancer producing chemicals. Lack of sleep is another thing, when your body is probably active, always acting and working, so chances of having cancer is high. So you need an adequate sleep of 6 to 7 hours. Stress. These days you cannot avoid stress. Stress is inevitable, but you can always have relaxing activities like yoga or gardening, listening to music, reading. So all these are the things, that ways you can prevent any cancer. And for the genital organs, again, the healthy lifestyle is very important, and be careful about safe sex as well as multiple partners. Cancer patients need everybody's support, the family support, friend support. In what way? Not to look at them as cancer is a major disease that they are going to lose their life. It is better always to treat them as a friend and make them feel normal. Do all activities with them. Cancer is not contagious, it is not communicable. You can hug them, you can hold hands with them, and you can kiss them. There is no way that it is contagious because you touch them. So make them feel at home, and especially in case of female cancers, the husband plays a very important role. It is because their femininity is questioned. Their femininity, they feel that they're less of a woman, and the husband will not be able to accept it. So there is an extra responsibility for every husband when the wife has got one of the female cancers, including the breast cancer. So it is not contagious, so you can hug them, you can kiss them, and you can make them feel that everything will be all right. With treatment, it will be cured and she will be normal. So treat them with love and respect, and always have an arm around them. For any cancer person, one is a family support. The other thing is there are support groups, that is people who are suffering from cancer or similar type of cancer. They can get together and discuss, and they can gain strength from the other patients, whatever the experience they have undergone. So this is a very important thing, and most of the countries have such support groups. But here at the moment in Oman, we don't have. But I would like to start if anybody wants to, because I'm in Oman, and it is very important, because when you hold hands together and support each other, and for example about hair loss, somebody says my hair is falling, so they are petrified by it. So the other lady who has gone through that and got her hair back can always say that it is only a phase, it's only a momentary thing, it will be all right. For example, loss of appetite, putting on weight, or some people do not have the drive. Young ladies, after some time, they would still want to continue their family life or sex life. So they are all very shy and apprehensive. But when you have a support group, it will be easier to discuss and give support to each other, and also bring them out and give them hope and strength. So support groups are very important. And in the family, as I said, the whole family can have activities together and give them the feeling that they will be all right. In any insurance, I'm sure everybody knows that if it's once the cancer is diagnosed, then you cannot go and take up an insurance, because you should have at least 1 year of that insurance you should be under. And after that, if the symptoms are developed, yes, all the insurances cover your treatment, management and everything. But if it's a pre-existing disease, they do not cover it. There were a couple of insurances that started, but they were not successful. I remember by NBO they had, but at the moment we don't have any particular insurance. Once the cancer is developed, then you cannot be supported by any insurance. Self-breast examination, as the words go, you examine your breasts by yourself, which means not to panic and detect cancer every time. It is to know what is normal for your breasts. Being a very sensitive organ, we often don't even like to touch them by ourselves. But every month on a specific day, preferably 5 days after periods, girls after 15 years of age should do self-breast examination, and for which you don't have to go to somebody else. You don't need to take extra time. It takes only about 2 minutes. You don't have to spend any money, and you don't have to feel shy. So you can know what is normal for your breast. When something abnormal happens, you can go to the doctor and get it re-evaluated. So self-breast examination should be done from 15 years of age until old age you should do, and monthly once, 5 days after periods. It should also be done by pregnant ladies, because even pregnant ladies can get breast cancer. And during pregnancy, we know that we don't get periods, but you can mark a date in the calendar, like the 5th day or the 10th day of a month. The same goes for ladies who have undergone menopause or had hysterectomy. Also can mark a particular day in the calendar and examine every month. Now, in self-breast examination, we're going to have a small thing of TLC, or tender loving care. You touch, look and feel a TLF. So it's only, again, hardly a minute. You have to put your hands up without any clothes on the top part. Stand in the front of the mirror in the bathroom, and with your hands up, down and on the side, look at the skin, outer part of the breast. Look at the nipples for any color change, skin changes. whether there are any texture change like an orange peel appearance, or there is any bulge, or there is any puckering of the nipple going inside, and whether there is any bulge in the underarm. These are the things that you look for, and if you find any gross changes of size which has happened recently, this is the look part of it. Immediately after that is the touch part. You do is always the right hand to the left breast, not the same hand and same breast. Never do that, and never touch the breast with one finger for examination, or the tips like this, or squeeze the breast. These are wrong. Instead, with the flat of the hand, this part of the hand, the right breast to the left, right hand to the left breast, and the left hand to the right breast. That's how we examine. And you can either support the breast with your same hand, or you can lift it up and do circular movements, vertical movements, and also vertical movements as well as horizontal movements. And you make this movement or the vertical or horizontal. The breast extends from the collarbone to the last rib, and the sternum to this part of the hand, the line. So this whole area you have to make the soft palpation and feel if you feel any lumps. The other thing is, finally, you squeeze the nipples and see if there is any discharge. If your whitish discharge or yellowish discharge, there's nothing to be worried about. You can go to the doctor if you want to check, but that is not an indication to be worried about. You can have milky discharge as long as you're alive. There are milk hormone and other hormones in the body till you die. Whereas if you have any brown, black, red, or variations of that color, you need to go to the doctor to evaluate if it is normal. 85% of the findings that you do when you are doing a self-breast examination is normal. And finally, you will feel the underarm also with the opposite hand to feel any nodes or bulges, lumps that you can feel. This is called self-breast examination. Sometimes people have itching of the nipple with skin excoriation, even that which it is not going away with any ointment or oils or so, that needs to be addressed. So self-breast examination to be done at home 5 days after periods. And we have developed an app which is called Pinkypromise-Alnoor, which can be downloaded from your smartphone, and it will tell you how to do it, and there is also a calendar when to do it, and you can even mark a reminder is there. The whole thing is there in English and in Arabic at the moment, so you can do this to do self-breast examination regularly from the age of 15 years onwards. In Oman at the moment, we do not have any particular group, but some of us are available, like myself, Dr. Rajayashree. I'm available for at any point to have a personal discussion. You could use my WhatsApp or Oman Cancer Association. Sometimes we do have doctors who can help you out. But at the moment here we don't have, but internationally there will be a lot of groups. You can go online and you can check and do that.